We'll take a look at symptoms of hyponatremia. Hyponatremia in most patients are generally asymptomatic, except it is in very severe cases. So most times, hyponatremia are usually discovered or diagnosed accidentally. Maybe when they are trying to do a general blood work, maybe a patient comes in and they are trying to do a general investigation, and then you discover that, oh, this patient is having hyponatremia. Now, the symptoms of hyponatremia is mostly dependent on the severity. It's dependent on the severity of hyponatremia. Now, a gradual decline in sodium concentration will usually result in, in minimal symptoms. Symptoms will not be serious. But when there's a rapid drop in sodium concentration, it can result in severe symptoms. So symptoms mostly is dependent on the severity and as well as the rate of decline or rate of drop of sodium concentration. So general symptoms of hyponatremia include polydipsia, excessive thirst. Now, you know that the volume is when it's hypovolemic, most times you see that the volume is low, sodium is low. So one of the symptoms of hyponatremia is polydipsia. The person is thirsty, always looking for water, looking for water, looking for water. That's one of the symptoms of hyponatremia. Then another symptom is muscle cramps. Muscle cramps is another symptom. Headache is another symptom. Mental confusion is another symptom of hyponatremia, and as well as altered mental. Now, those are symptoms that are associated with um, with severe cases, with moderate or mild cases, mild to moderate cases. But in severe cases of hyponatremia, what you find is seizures. You see the person having seizures, jerking. Then also altered mental status. Person will start hallucinating, loss of memory, loss of consciousness. Before you know it, it can even in severe cases of hyponatremia, it can result in coma. It can result in coma, and then rarely, but it can happen. There can be respiratory arrest in the individuals, right? There can be respiratory arrest in the individuals. So in this situation, in this situation, there is particularly in severe cases, there's usually it's usually an emergency situation that results or that requires emergency interventions. So those are the symptoms, and then we look at the laboratory diagnosis of hyponatremia. Now, the laboratory diagnosis of hyponatremia will not be used without preliminary examination by the physician. For example, history taking to know, ask questions to know how and what could have led to the hyponatremia. If there's hyponatremia, physical examination, the physician will look at the patient, take a look at certain things in the body of the individual, and then the laboratory test, followed by the laboratory test. Now, the laboratory investigations include the measurement of electrolytes. Now, you don't measure sodium in isolation. So we measure electrolyte generally, like sodium, potassium, calcium, and bicarbonate, and urea creatinine, urinary sodium levels, as well as urinary creatinine levels. Now, why are you doing all these other investigations? Because you want to know, is it an isolated case of loss of sodium alone, or are other electrolytes part of it? Is it a renal loss, or is it an extrarenal loss? All these things are what should be looked out for in investigation, in laboratory diagnosis of hyponatremia. The another thing too that can be done is the measurement of serum osmolarity. It can be measured and be calculated also as part of measurement or diagnosis for hyponatremia. So that's it for hyponatremia. In the next topic, we are going to be looking at hypernatremia.